Oh, I love it. All right. Well, glad to have you guys online and everyone here in person. Again, thank y'all for joining us however you can. It's great that we have these options. I want to take just a minute and give you a few updates about James L. West, and then I'll turn it over to, I think Dr. Ross is next on the agenda.
Barb and I.
Barb and you? Okay. All right. Well, we have had a lot of moving parts here at James L. West the last year, and trying to get a few of them to wrap up. It's been an interesting year with construction and contractors and regulatory issues, but we're getting there. A little over a year ago, we decided to purchase a building for our adult day program. So it's open here in the building, and we're serving 15 to 20 people a day, and enjoying taking care of them here in our little small space. But we bought a building, and we're going to be moving over there one day, but we've had to renovate and do some things over there, but it is beautiful. It is located on the corner across from Harris Southwest Hospital, and it's very visible and easy to get to. And so there we will be able to serve up to 60 people. So it's much larger than our space here. We are having our final inspection today, fingers crossed. So as soon as this is over, I'm dashing over there. To hopefully we get our CO. We're hoping and praying for that. And then we'll wait for our HHSC friends to come inspect it. So maybe in the next 30 to 60 days, we'll be moving over there and get our folks taken care of there and be able to expand. So it's beautiful, has a great, beautiful outdoor area. We'll be having an open house at some point, and you all will be invited. We are celebrating our 30th anniversary this year. And we have so many things happening that we aren't doing like some big, huge splash, but we're just going to celebrate all year long with all the things that are happening. So we will have a big splash for our staff in August, and we always do something for them on our anniversary. So 30 years right here in this location as a not-for-profit, started by First Presbyterian that many years ago. Dr. Knable, who's also one of our medical directors, was on the founding committee for that group, and she is still a medical director here. So we have a lot of longevity here. And if you on your way out, well, behind some of you over there on the wall, we have our 30 years of employees. So you can see Dr. Knable's right there on the top. And we have employees that have been here as long as 30, 29, 28 years. Isn't that amazing? And some of the folks that are have been here the longest are direct care staff, which makes it even more amazing. So we've got a few CNAs that have just been here the whole time and loving taking care of our residents, which is just astounding to me. So I was really excited because I got to be on the 5 years this year. I've been waiting to be on the poster. So I just celebrated my 5 years. It's kind of a thing, you know, everybody is excited to get their name up on the poster. So okay, and so the other thing that we've been working on, we did have Community Hospice of Texas as a tenant on the 4th floor, half of our 4th floor. And they had been there almost 20 years and they had it as an inpatient. So a couple of years ago, we talked and let them know that we were going to need that space because we've been running full for a long time now. And we let them know we needed that space. And so they moved out in December. So we have a new suite, and it's called Wichita. 12 beautiful private rooms that are in short supply here. We don't have as many private rooms as we would like, so we're adding these 12. So we are waiting for regulatory folks to show up and bless that unit so that we can open it. It's beautiful and ready. And then in addition to that, or in partnership with that, we decided to apply for Medicare. So we have been a private pay facility for 30 years. We have had a VA contract for about 10. So the Veterans Administration can pay for veterans to live here if they have dementia. So we've taken care of veterans, and we decided that we really wanted to be able to do some short-term rehab with people who have dementia. So in the rehab nursing world, most nursing homes do this already. Most nursing homes provide short-term rehab for people coming out of the hospital. You go there, you get your hip, your stroke, whatever rehab, then you go home. So we've never done that. We were one of 7 nursing homes in Texas that did not take Medicare. And so we applied for Medicare. We have had our survey and we're just waiting for the little piece of paper with our number on it so that we can start admitting people from the little piece of paper from CMS. And then we will be admitting from the hospital people who have dementia and need short-term rehab. We will help them. We have a great therapy team already because we already provided therapy here. So we will help them rehab and be able to go back home. So we anticipate mild to moderate level dementia folks that want to go back to the community and live in their home. We have, really, obviously they could stay here too if they chose to, but long term. But we have really been working on being more community facing. So for a long time, we just were this building. And we've been working the last 5 years on being more out in the community, more community facing. So this Medicare program will help us serve people who don't really live here, who live at home. Our day program can then be a great referral source for those folks. And as we move forward in our 30th years, we're looking at even more ways to get involved in the community and start some community services. So, well, you'll be hearing more about that as we move down that road. But right now, we just want to get these 3 things: this unit open, the day program open, and Medicare started. And then we will celebrate that. Little things, yeah. Yeah, just one check mark would be great. Yeah. So I will turn this over to Barb and Dr. Ross now and let them carry on with the program. Thank you.
Right, so we have just 10 slides. We're just going to take 10 minutes-ish. So first of all, thank you so much for having us to just share a little bit at this meeting. And where do I need to stand for the people online to
They
see
can see
me?
you where you're at.
Okay, good deal. So do we have, just presentation mode so that it's not on there, and then we can just use that to toggle. So
Maybe.
oh, I can use the computer. Yeah, I'll just do it that way. So we wanted to share with you about a training that we had the privilege of doing for the certified nursing assistants here at James L. West, and we'll give some details about that. And I'll start just with a little bit about the funding and then let Barb jump in to talk about the training itself. We are one of I believe one of 48 geriatric workforce enhancement programs in the country, funded by the Health Human Services Commission or Administration, HRSA, and the geriatric workforce enhancement program that we have here is called Workforce Enhancement in Healthy Aging and Independent Living, or WEHAIL. And we received that funding in 2015, and then in 2020, we're able to renew for an additional 5 years. And what was very exciting, one of those silver linings of the pandemic was additional funding for nursing homes related projects and initiatives. And so, the geriatric workforce enhancement programs in general are for training any discipline on caring for older adults, more generally, a lot of education about dementia, but not a lot of focus on the long-term care space. But we were one of 11 locations to receive the additional funding to focus on nursing home trainings for just a period of 2 years. So that 2-year period is actually ending at the end of June, and we're keeping our fingers crossed that there'll be additional funds to carry on and continue some of these programs we've started or to expand them. So the nursing home supplemental project was again, created or started out of needs brought to attention through COVID, with the purpose being to create and deliver training to the nursing home workforce, the residents and families themselves as well, and help them care for folks with COVID and with other conditions that impact our residents in nursing home settings. So this is just a quick overview of what we have been doing with this additional funding for helping support and train the nursing facility workforce. Our first project is under objective 1 is in conjunction with the TMF Quality Improvement Institute, and they have recruited different nursing facilities that they coach and mentor through quality improvement projects related to advanced care planning. So that was something we were really excited to do. The second project is related to the entire nursing home workforce, and we utilize Project ECHO, which stands for Extension for Community Health Outcomes. And so it's basically using Zoom and video conferencing opportunities to create a learning community where folks can participate in a brief didactic session and then in discussions and collaboration on cases and problems that are actively going on, so that they can have a space for mentoring and sharing and learning. The third is the one we're going to talk about today. We wanted, and the funding dictated that we provide training to the CNA workforce. And the other great thing is that there was room within the funding for incentive payment. And so that was a neat thing that that this entailed. And that objective just dictates some of the things that HRSA wanted us to be sure to cover in a training for CNAs, dementia care, community resources, COVID vaccine education. At the time, the funding came out, there was a lot of hesitancy with regards to the vaccines. So providing that education was very important to them. And it's evolved. We had to update that content for the second time. And obviously that's been an evolving landscape that we've had to keep up with. The fourth objective was education for residents, advocates, and ombudsmen. So we have an epidemiologist who has created a curriculum and a program for infection prevention and control. And it's called iCare. It stands for infection. Oh goodness, now I'm gonna blank on it.
It's coming to you. That's what
Yeah. Infection control for resident and advocate education. So it's for an audience of the residents and families, and then ombudsmen for helping them to be empowered to fight COVID and whatever other infection might be in our be at risk of being in our building. And the last one was some online and durable content. So we actually have our movie stars right here. We created some little brief modules for a CNA audience, and Barb Hardy was the CNA, and Jane Oderberg was the individual with dementia, and they did a good job just doing some demonstrations of the right way to approach folks and help with dental care or different things. So yeah, now that we're going to have to share those links for you to see them. So and now Barb's picture is up, so I got to get her up here. So like I said, Barb helped us out with the CNA training, and the objectives were to cover the topic of infection prevention and control, also to talk about ways that the CNAs as individuals could advocate for themselves and their resident. We talked about patient and resident safety tools with the team steps, and person-centered care, dementia-centered care, and then also self-care. So that was a good one as well. We had our psychiatrist come. So I'll let Barb jump in with a little bit more details on the CNA training we did.
Thank you.
Yeah, thanks.
Okay. One thing I will say, talking about the Medicare program, I go to another facility we're going to have upstairs, and for short-term rehab, and we get someone in with dementia. And I mean, we got all sorts of people in, but we get someone in with dementia, and the nurses are calling me constantly. They're agitated, they're this, they're that, totally unrelated to why they're there. What do we do? What do we do? So this is much needed. I was so thrilled when I heard it, because they just don't know how to care for someone with dementia. And they've even have asked them to leave sooner than they should, because a lot of them can't do the physical therapy, they occupational, they don't understand, they're in pain. So, it's a lot of pain control issues, and trying to help them understand why they need to do it. And then the family has to take them home before they really have the therapy they need So, yeah, it's much needed, much needed. So anyway, this was a great program. The first round we had was mostly James L. West CNAs. And then we did the second round and we had CNAs from several places and we advertised it. We had posters. We drove to different places and I cornered the administrators and you give them time off to come to this. They need them, you pay them for it, you know, so the second round, we really had a lot of people, CNAs from different places. And what it was 4 Fridays in a row from 8 to 12. We fed them well. And then we had all our speakers come in and everyone did a session. And we had great feedback on it. And we made them very interactive where, you know, I'd give them, because I've been here actually 27 years. Because I did a year internship here. And 3 years. So yes. So, you know.
Correct our poster already.
Yeah.
I had long dark hair when I started. What has happened to me? Working with dementia residents for 27 years, I guess. So anyway, so that's great. We're doing that. So anyway, so that's
Yeah,
what.
next slide has what you're talking about. All the
Oh,
different-
okay.
Yeah, just the arrows on the computer.
Down. Okay. So here's what we had. I did look at it. 20 other things. Okay, so these are the pilots. Like I said, we got speakers specialized in this. Like we had our physical therapist person there at UNT, head of physical therapy, do body mechanics. And, you know, we really made it interactive. It was great fun. We had things you do on the computer or your phone. What's that called? Cahoots. You know, everyone challenged them. And then I'd say something like, do you have a patient that does this? And oh my God, that really got there. Yes, and then they all start talking among themselves. So it was really, really cool. Germs, we had a infection control person. So all of this, our psychiatrist came, we had, you know, we really went through everything. And caring for self, Holly did, it was really good. You know, we're trying to show the CNAs we really value them. And I tell them that all the time. You know, when I go see residents up here, I'm going to the CNAs lots of times, you know, what have you seen? Because they know them, you know, what's going on with them. So, and we try to include them in a lot of different things. And they, you know, they appreciate that. And working in teams was great. That's when we kind of got everybody together.
Yeah, I'll just throw in the session with our psychiatrist. She did an engaging activity where they were all working together. And then she followed it up with meditation. Like it was very neat how she, you know, we tried to make it interactive where it wasn't just sitting, listening to it.
Yeah.
We actually had, you know, different activities that they had to, you know, write down their strengths, share that with a partner,
Yeah.
or, you know, act out something or read a case.
They really liked it. They were so engaged. You know, it's like no one had really talked to them before. And one thing I started with, I did the dementia care, was, you know, kind of what's actually going on in the brain of someone with Alzheimer's or vascular, Lewy body, whatever. And they were all leaning forward and they said, we get training on how to care for them, but nobody's actually told us what's happening to the brain. And it kind of morphed into quite a session about research going on in the world. I mean, it really morphed into a lot of different things. And afterwards, they were all like, thank you so much. Now we know why they repeat themselves. Nobody really told us just that it's a disease, but now we kind of know why they're doing it. So this is what we had. You can see we really increased because we really went to a lot of facilities. We asked them a lot of questions. Did you like the length of the training? You know, the frequency of the training. And you can see everyone really agreed. They did get a gift card. So, you know, for each session.
They got a gift card, yeah, for each session.
Yeah, so that really was an incentive too. So we have had it in the grant, so we could do that too. But, you know, we did have one question on there at one time was, you know, what made you want to come to this program? You know, we thought it might be the gift card, but most of them, it was real wonderful to me. I want to do better at my job. Seeing a lot of times, you know, between the families that are so stressed, I know, and everything else, they really didn't feel that, you know, they were getting the support sometimes they needed. And here at James L. West, and I go to a lot of been to a lot of different facilities, they really value the CNAs and include them in so many things, you know, on committees and every place I go. Now I go anywhere and everyone's hollering to me, and because I really try to engage with them. I don't just walk in and And so this is what we had. You can see we really tried to center it, especially when we did the second group, what worked well, what didn't work well. And we kind of tweaked a few things on it. Here's what we had, and you can see the majority,
It's all 8 sessions is what it is.
yes, we
So
had,
that's the 8 objectives, one for each session. Did they agree with the session meeting that objective?
and one thing, most of it's very positive. One thing was we had to tweak like the virus information. It got a little detailed, I thought, because I was trying to follow it too. So we tweaked it some. I mean, it had a lot of good information, but again, we kind of looked at what they really liked and everything. Discuss symptoms of stress, how you can identify your strengths, the behaviors. I did all the behavior stuff. So it was really very positive. So we were really, really thrilled with it. If we do it again, I think we've kind of got it where we need to have it right now. And here's what I was talking about. Why did you decide? And I want to do my job better. I don't know if you can see it. That was the main thing. I'm required. We thought maybe for the CEs they have to get, or CEUs. Most of them, I want to do my job. I wanted the gift cards. I thought that would be big, the reason. And, we had a hard time because we know a lot of them some of them work 2 jobs. They work shift work. So, that's why we tried to spread it out and, get as many as we could. Nobody fell asleep during my session. I don't know about the others, but I kept them very active. If I saw someone dozing off, I would pinpoint them. What do you think about this? So what's your preferred way to complete the program? So if you can't see, this says in person. So everyone likes that. Not too many virtual live, virtual on demand, hybrid. So almost everyone liked it in person. And I think a lot of that's because we made it so interactive. We were up, we were down, we were moving around. So here's some of the comments. They wanted more, an eye opener, because I think some of the things we talked to them about, they really hadn't, been discussed or anything. So anyway, but we took a lot of pictures. You can see everybody's up moving around. Nobody got to sit for long, for sure. And then we did the modules. So we did a lot of different modules and sessions. And this is what Dr. Ross was talking about. And they filmed us, and we have those online now. And
The link will be in the PowerPoint, or the link is available if Jamie wants to share it.
yeah.
It's embedded in that PowerPoint. If you see on the bottom right, click here. So we can share that link. There's a landing page for all of the home relevant.
Yeah, and it was really good because, that way, and me and Jane, she was obstinate and stubborn. And I don't want
I know
to.
you all can.
Right.
And then I had to convince her, yes, let's go to this music program. I don't want to, let's do this. So anyway, so that was a lot of fun. So we got those done. And then we had the eye care program too.
Did I get the acronym right? Infection control, advocate, and resident educator.
Yes. See, and they're shorter and everything. Anyway, but a lot of this would be good also for families because they sometimes don't understand. And I think they think when they come here, I have a family member say to me, they haven't bathed my dad in 5 days or something. And I'd say, can you bathe him at home? And they say, no. And I said, well, now it's strangers trying to bathe him, but you're specialized, you're all trained how to do it. And I said, you're right. But, then it goes into the training on the disease process. And I said, we will get him bathed. It just might take longer than you'd like. And I've even written an order, bathe the right arm on Monday, the left arm on Tuesday. I have written orders like that. Just do what you can. The other thing is, when they're at their best, it's not like when I first started, not so much here, but I've been to a lot of places. Everyone had to be up at 8 a.m. with shiny faces and dressed and have breakfast. And they would just put the tray in front of them. And if they didn't eat it in 30 minutes, they'd take it away. So we have changed in most of the facilities where, they're paying a lot to live here. So if they want to sleep in, if it was my mom, let her sleep in, but we always have snacks available. you know, and then also if they, you know, if they're better, say, in the evening, that's when they should get their bath. Did they take baths or showers? Which do they prefer? You know, if they've never taken a shower, it's gonna be hard to do that, you know, and so we adjust again, person-centered care. And so what we do when they first get here in Holly Hope, so this is we get, we have a wonderful activity director and we say, what are their favorite activities? You know, music, Bible study. We have a guy who had his wife here. She died here. He does woodworking once a week, I think. And you should see, I was up there the other day going, Barb, come up and look. They had little rolling ducks and stuff and they were sanding them. They don't have like drills, I don't think, but saws. They were saying they're going to paint them and give them to Cook's children. So an activity director is so important. And some of my facilities do not have them. They have people sitting in front of the nurse's station and it drives me nuts. I usually end up sitting there instead of seeing patients and talking to them, and you can activate them. I'll say, what a beautiful blouse, you know, where did you get that? You know, and they just light up. So I spend a lot more time doing that because I think, you know, we need to do, and James L. West is great. The other facilities are getting better because I'm tenacious. I bug them till they start. But don't look so surprised. So, okay, so any questions? It was a great program. I was happy to be a part of it. Of course, my boss puts me on a lot of grants, so I'm so used here, Barb, you're on this. Yes.
Was there a cost?
No.
Oh, that was
They actually got gift cards. They got a $25 gift card for every session.
And what about, are you gonna have another one?
Well, that depends on the funding and them extending the grant.
Okay.
And if not, we do a lot of UNC because it is a, you know, it is a college academic setting. So we do a lot of different things. So a lot of different training sessions. So, and I assume probably when we get the upstairs Medicare that, you know, we'll probably have some lunch and learns. I'd like to do that to talk to the families, kind of what to expect and why they may not want to participate and what we need to do. So we'll kind of work with that too. Anything else? Oh, thank you for your time.
I'm just listening to our CNAs. They really enjoyed the training, got a lot out of it. And we are thrilled to partner and receive the training from UNT. So we're going to switch gears for a minute and bring Leah up. She's with Care and Prepare. And this is, there's been some change in advanced care planning documents or updates, or Leah will explain that, but we wanted to make sure that all of you knew these updates and changes that were coming down the pipeline for our own education.
Thank you. This is fun. Thank you guys so much. It's an honor to be here with the council this morning. Show me which button to push, right? 'Cause I like to push buttons, but I want to make sure they're the right ones, right? So some people have said, you know, I've never heard of your organization before. And I said, well, you know, that's odd because we've been around for 25 years. Maybe you know our other name. It was Coalition for Quality End of Life Care. And when I came on board 7-8 years ago, I realized that is a conversation killer. We need conversation closers. We need openers. We need Velcro. We need to invite people into what can be one of the most important decisions of their lives. One of my best friends says, that is the most important decision I've made in my life. And strong work. You got it done early. That's awesome. Cool. So, all right, nice. I'm going to go back to the very beginning, a very good place to start, because I want to challenge us. You know, some of us have been around for a little bit. So what would the world be like if we had a new pair of glasses? I want you to know, I've gotten some new contacts recently, and the first one was a no-go. I was seeing the world differently, but it wasn't so bueno because I was having to do this number. And I think our perspective is really important. I'm truly grateful and thankful for the board of Care and Prepare. Number one, because they said, you know, we could adopt a name that, I don't know, easily reflects what it is that we're doing. And so that's why our name change came around. We're going to be 25 in the fall. So I'm kind of excited about that. It's not 30 yet, but it's 25, so that's cool. And I am so grateful. I get to work for the board. My goal is to bring their hopes and dreams and aspirations to life for our organization. So let's do a little bit of history. I told you some. Back in 1999, we had a lot of people talking about, what would it be like if we kind of spelled out what our healthcare wishes were, and how could we explore what our healthcare rights and responsibilities are. So in 1999, Doctors Fine in Dallas and Dr. Belfi in Fort Worth were called upon and put some of the language that's in the statute from 1999 and is still there today. Oh, sure enough, there it is. So my personal experience with advanced care planning conversations hasn't always been bueno. I don't know about you, but sometimes it's just a real heavy topic. And if this is going to be one of the most important decisions that somebody can make for themselves or can help their family through, maybe we should think about reframing it. That's what I'm interested in doing. And also, can we talk about what's happening? Do we do advanced care planning in Tarrant County? Is anybody doing it? Of course, we are. We are doing it, but are we in it together? It's, I think 10 to 15% is what we're saying is about the average number of folks in DFW that have their advanced care plannings in place. But I can tell you that it's not so much person-centered. It's kind of like you go to this facility and you're going to have the big toe surgery and they say, oh God, this is big toe surgery and we're going to actually, give you something to kind of calm you down or you're going to be out. So they have their particular paperwork available. But then the question is, do you know what that paperwork says? Because I have people bringing in paperwork they got 10 years ago and they're like, I don't know what this is. Well, we believe that person-centered care is awesome at UNT Health Science Center. Thank you for presenting the update on that. That's the way we feel like it should be throughout the community for advanced care planning. And wouldn't it be awesome if it was just like integrated into every healthcare record imaginable? That'd be awesome. And care concordant. Wow. How about accessible? If your doctor saw when you went into the facility, if there was a quick way that they could say, oh, Mrs. Jones really, she's 97, she's got bone cancer. She's kind of, let me get on the Jesus bus, don't hold that up. Well, it would be awesome if we could take some of our resources that we already have in technology and marry those together with the patient-centered care, because I'll be brutally honest. I don't want care that's not concordant with my situation. So that would be the goal, is for there to be ACP for all, advanced care planning for every single person. And our hope is to pull together more folks like yourself to say, how can we collaborate to bring this out of a dream status to make it reality? And the awesome news is it's happening. So that's one of our revolutionary ideas, is to apply technology. A lot of times having a conversation really, any idea what stops it? Fear. And we've already seen a society make a whole lot of decisions based in fear. And that was the last 3 years has been really tough. I mean, I was wanting to take my TV in for problem. It keeps saying unprecedented. I thought it was a drinking game at one point. I was like, does my TV always say unprecedented? It's a record number of times in the last year. What is going on? I will say that if you're here today, it's a perfect day if you haven't done your advanced care planning. We're incorporating some new language. I don't know if you guys recently heard about Damar Hamlin. He was an amazing specimen, a very physically fit, athletic young man. Had he chosen a champion? Well, no. the sun was shining and all was going well. And so he didn't need a champion. But sometimes freak accidents happen. And so wouldn't it be great if we could put this into a positive light so that people might understand that today really is the perfect day to choose my champion, to speak for me, just in case I can't speak for myself. So I've always thought that our faith is a wonderful way. It's a natural conduit. It's people that we share values with, usually a lot of time. If you're going to the same church, or synagogue, whatever your house of worship is. Well, even if you tell me you're not religious, I'll say there's something you believe in. Science, spring training, baseball, March Madness. Those natural spheres of influence are a great place to cultivate the conversations that can really change our lives. So our goal is really to reframe this into something that's more of an exploration of what your desires are, what your wishes are. And so we are putting together not only new language and developing curriculum, but we've also monetized our model. A nonprofit, we figured out how to move into a unique revenue stream for us. And I believe that this is the first of many revenue streams that we're creating for ourselves. I love Booker T. Washington, and he's my inspiration for saying, you know, there's a lot of people doing ACP in town, but is there a more excellent way? And I would say yes. Yes, there is a more excellent way. We heretofore, 2020 and before, we did a lot of larger events in houses of worship and all other places. But we took a step back from that and we said, you know, here's a question. Could we deliver advanced care planning in a physician's office? Would it be valuable to family, friends, loved ones? And would it be viable in the clinic setting? And so this launched our hashtag ACP for all, because in 2023, everybody needs a hashtag, right? Great news is when you plug in this one, we're the only folks that come up. So we did a beta site in 2022, and I have a copy of our white paper if you'd like to take a look at it. I'll spoiler alert, things went really well, which is awesome. It was very viable for friends and families and loved ones walking through this. I personally believe that this is a patient safety issue. And that's something that I'm not certain that we've really kind of camped out on, that particular nuance of advanced care planning. So if you liked what you heard and saw, I have copies of our white paper. I wish I could teleport with you back to last week, 3/23 of 23. I was like, man, that's a momentous date.
Yeah.
We had 9 new facilitators that we trained. And we're going to need every one of them. We're going to be doing this course again this year, probably a couple more times, because the wonderful problem that we have is we have THR and their physician group, THPG, that are saying, okay, well, how soon can you get into 5 of our regional clinics? I'm like, well, hold the bus, dude. I'm in a pilot project. So I'm really excited about helping out Dr. Stuart Piquel. He's going to be our second site that we'll be going into. And so we're going to need more volunteers as well as paid staff to do that actual facilitation in the office. Now, some of you have actually come to a facilitator training course before, and I'm thrilled that the James L. West Center is partnering with us again. They're going to be hosting the facilitator reunion April 20th. So still spots left. So please sign up. And that way you can kind of catch up to what is going on. Now, Jamie alluded to the fact that there's been some changes. And so many of you, has anybody seen a post form for national? Okay, a couple of folks. So that typically is seen by a provider, healthcare giver. And so what Texas did in the past was the most form, but something happened. Kind of sad we left most behind, because I could just see, we could market this as Texas Cares Most. But they decided to go with the Texas Post. Somehow or another, they felt like, well, you know, for like every other state, maybe it'll, you know, help us out in our cause. So I have a copy of the new form that has come up. It looks a lot like the national post. It's slightly different. Part A is a little bit different. And I understand from the national folks that actually in Texas, you as a patient don't have to sign, but your providers can. With the national form, it's definitely got to be signed by patient and provider. So that's a little bit different. I brought copies for practitioners that would like that. And I also have, if you would like, I have our white paper that shares some of our results. So I can tell you that 9 out of 10 people that participated in our group, actually, we billed their insurance company through Dr. Barker's office. Dr. Jerry Barker is a radiation oncologist, and this is kind of part of his brainchild, along with our strategic planning team, to deploy advanced care planning into clinical settings so that hopefully the people that need it most have first access to advanced care planning. Now, I say that, but like DeMar Hamlin, we never know if some kind of freak accident, might be headed our way. And I will tell you one other thing. In the early days of advanced care planning, they found out that actually people in their 20s was when the legal landmark cases were decided. Those were the patients that had their original accident, illness, or injury were in their 20s. And they did not have their healthcare agent documented, and didn't have their healthcare wishes documented either. So if you can remember Karen Ann Quinlan or Terry Schiavo, our whole nation can go through angst. Really, there's a better way. And that way would be have your advanced care planning already taken care of. So I really do appreciate your kind attention. You might have some questions for me, but if you don't have a question for me, I have a question for you. What if the case study is you? Are you prepared? Well, you can be. Just take your phone, shoot it up here at the QR code, and it'll take you to our homepage. Look for the resources page, and we have lots of info there. The new PULSE form is there. We've got the medical power of attorney. I call that choose your champion. That paperwork is there. I also have the statutory power of attorney. That's the durable one that controls your assets. So we learned that a lot of people that got COVID, that got in the hospital, if they didn't have a champion that was chosen, they didn't have somebody that had a durable financial power of attorney, rut-row, that's your cash money and your healthcare system, your healthcare choices that are just kind of locked up. You're going to get the special of the day, whatever that is for your hospital du jour. So you don't have a plan, the state has a plan, and you may or may not like it. So why don't you just make your own, see how that works. All right, well, thank you so much. I really appreciate your time and look forward to getting some feedback.
Thanks. Can we share these slides?
Oh,
Your next speaker. Mine is super short. I really value the work of our collaborators, and we really start every project and conversation with a spirit of collaboration and with an eye toward really all ships float higher when we all work together, right? Doesn't matter what sector or what topic. And so from the training perspective, our education program is 11 years old. So we celebrated our momentous anniversary of 10 years of caregiver and dementia education last year. We have been strategic planning all the way through COVID. Those organizations that waited and worked through COVID are now starting their strategic plan. We're seeing the fruit of our strategic plan as we move forward. And one of the priorities for us is keeping an eye on legislation from an advocacy policy perspective. We clearly are not your grandmother's nursing home. We do so much. And even as I speak to collaborators across the country, I spoke to someone in Kansas City yesterday. They said, you guys are the MIT and Harvard of dementia care. I mean, like, you are the experts, because they're a CCRC, meaning they have independent living, assisted living, memory care, you name it. And so sometimes when you're so close to what you do, you taking a step back and seeing the impact is truly meaningful. And so this partnership that I'm going to tell you a little bit about is an emerging project and program. We pulled our Dementia Education Advisory Council together many years ago, and I was just visiting with Nora because we started pre-COVID because there is strength in collaboration that we informed you and you inform us. And so we are working in partnership with the Texas Assisted Living Association. There are lots of people living in assisted living that have dementia and advancing dementia. And in some cases, that environment isn't the most productive environment for them, but it is their environment. It's what they can afford. It's where they live. So we took an approach in working with TALA. Our education team has been a partner of TALA's for many years. Their sessions are oversubscribed at the TALA conference. And looking at that and working with Linda Abel, I sat through the AL Managers course, just sort of listen and learn what that was all about. And at the very end of the course, they identified state mandated training for leadership in assisted living as it relates to dementia care for residents. And so that was a direct tie to the work that we do in our education program, and began the conversation with the Texas Assisted Living Association to say, how do we formalize an education program with benchmarks that help us measure from a pilot perspective the impact of education on outcomes in assisted living. And so we have a formal partnership with TALA, and we'll start a year-long education program in August to work with them on this pilot study, which happens to also coincide with enabling legislation or active legislation in Austin in the House that's being carried by Representative Capriglione from Flower Mound, that also touches upon dementia education. And so all of this to say, we keep really this micro and macro viewpoint on what we do in education as we look at the needs of the community. And so we will continue to keep you updated as this TALA partnership unfolds. Once we have the pilot framework worked out, we would love to share it with our Dementia Education Advisory Council, because there is a lot of overlay of this specific pilot project that can happen over the next few years. So, Helen, you're up next.
And in a spirit of collaboration and dementia education, here at the West Center, we welcome and have always welcomed students in any form or fashion. So we are delighted to bring Kellen up here. She's going to share with you a project she's been working on with our senior day program with James O. West through the Texas Women's University.
Hi, everybody. Good to see y'all this morning. Thank you for having me. Do I click on the computer or?
Leah, did you take the clicker? Nope, I have it. Sorry. I'm just gonna blame you.
I had the same problem at home with my TV. So.
But I heard her last year.
Perfect. Okay. Yes. So like Jamie mentioned, I am a doctoral capstone student in the senior day program. And again, my name is Kellen. So just to give you a little agenda of kind of what I'll be talking about today, I'll tell you a little bit about myself. The purpose of my capstone project, I'll highlight the areas of focus I've chosen and then give you an overview of kind of the little projects I've been working on that make up my entire capstone, and then just a short conclusion. So a little bit about me. I am in my third year pursuing a clinical doctorate in occupational therapy at Texas Women's University in Denton. So I actually graduate in May, about 6 weeks from now. So I'm coming up on the end. I'm really close. And I wanted to share with you guys kind of why I chose this facility, because back in the fall of 2021, our university was preparing, telling us about sites we could go to and mentors. And Dr. Pickens is actually the reason I'm here. She had a connection with James L. West. And I have a personal experience as well. I had a grandmother pass away from Alzheimer's. I was very young. I didn't know her very well. I didn't understand dementia at that time, but I've always had this curiosity for it, and just seeing how it impacted my mom and her family. It really drew me to this facility. So that's kind of why I ended up here. And so the purpose of my capstone from my university's perspective is really to develop specialized knowledge and expertise in an area that might not be so traditional for occupational therapy. And although occupational therapists work with people with dementia very often, these areas of development were really the highlighted parts that they wanted us to look at. So not go in the clinical route, but perhaps the research route or the program development route. And so I started preparing for this capstone last summer. I communicated with Holly and Jamie about potential projects in areas that James L. West might need help in and what my interest might be, and trying to find a project that really aligned those two things together. I completed a literature review, and we came up with a memorandum of understanding, which was kind of a contract between me and James L. West to outline the objectives I would meet, my supervision hours, things like that. It is a 14-week project, so I am going into my 12th week next week. So my last day is April 21st, and total I have to get 560 hours for my project. Just to give you kind of some details about the logistics of the capstone. So the areas of focus I have chosen are program and policy development and clinical practice skills. So last summer when I was communicating with Jamie and Holly, we really decided that I was going to be working with the day program. That was where they really needed a lot of help. And so again, not the clinical route, but working with that program and doing some enhancement projects as well as some program implementation as they're moving to their new facility, like Cheryl had mentioned. But along with that, being in the day program, I am in the midst of working with all the participants. So I also will be highlighting that clinical practice skills, just gaining some knowledge working with people with dementia. So last summer, and then during my first week here, we really solidified the projects I would be working towards to encompass my entire capstone. So the first one was identifying some assessments that could be used in the day program. The second one was creating an informational manual for caregivers to provide them a tool, kind of everything you need to know about the day program. I would be completing a needs assessment for wraparound services, which I'll go into more detail in just a minute. And then completing some educational training courses for my personal growth so that during my time here, I could use that education and training in my everyday interactions and just have more information about dementia as I'm doing all of these projects. So the first part was identifying some assessments. So Heather is our day program director, and in collaboration with her, she really wanted to identify some assessments we could use to help standardize the process in the day program. And so first we wanted assessments to measure the functionality of participants. And so the first one we chose is the mini mental state exam, which really assesses cognition. And so this is one that they had used before, so we decided to stick with it. It's really easy to administer, it's free, and it can be administered almost like a conversation. So the person with dementia doesn't feel like they're being tested, or if they get an answer wrong, they don't feel bad about themselves. So it can be had like a conversation. And then bringing in my occupational therapy lens, I really wanted to pick an assessment that showed how the person functioned in their everyday life, right? The cognition piece can show you a lot, but how does the person get dressed in the morning? These are things that the staff is dealing with in the day program, taking participants to the restroom and, eating meals. And so these are things that we really need to understand how they behave and in those situations. And so I found this assessment. It's the Alzheimer's Disease Activities of Daily Living Inventory. It is 8 pages. This is just the first page, but it has a lot of different activities listed. So eating, getting dressed, going to the bathroom. So some of those basic activities that we do, but it also has activities like maintaining focus in a conversation, maintaining eye contact. Can they make a snack for themselves if they're hungry in the afternoon? So it really gave kind of the gamut of activities that you might interact during the day, and it gives you a scale to be able to rank. So this is done by the caregiver about the participant. And the next assessments were caregivers. So we really wanted to be able to track the well-being of caregivers, because one of the purposes of the day program is to provide those caregivers the time they need to do other activities, whether it's work, whether it's go to the grocery store, whether it's take a nap. The purpose is to give them a little bit of respite. And so we wanted to make sure that that was happening. So the modified caregiver strain index is again one the day program had used, easy to administer. The caregivers fill it out about themselves. And then I found this one, it's the Kingston's Caregiver Stress Scale. And so in collaboration with Heather, we chose these two because we felt like it really encompassed the emotions and experiences that a caregiver might have just with the questions it's asking, but it also provided a scale for them to rank those feelings and emotions. So we looked at some where it was like yes or no, and we didn't feel like that would really show the progress in their well-being that we wanted to see. And so these are the two that we went with. And again, this was really to standardize the process, but also it helps track progress over time. And sometimes in the day program, participants might become, we might have to discuss discharge if they become inappropriate. And so I think this helps ease that conversation because there's tangible evidence of kind of where they were when they started and maybe where they're at this potential discharge. So it helps ease the conversation staff might have to have with caregivers. The second part was the informational manual. So the purpose of this was really to provide the caregivers a comprehensive tool for everything they needed to know about the day program. And we really want it to be something that they kept handy, that they wouldn't throw in a closet or throw away, hopefully not, something that they would refer back to. So this is the manual right here. If you guys would like to take a look afterwards, you're more than welcome. But I listed out all the information that is in the manual. So you'll see it talks a little bit about just James L. West as a whole. It talks about the admission criteria for the day program. So what makes a participant eligible and ineligible. But it also talks about some of the education opportunities here, the support groups, things the caregivers might need to know if they're in, they're like, I'm really struggling. And so they can go to the binder and find, oh, well, they have a support group this day that I could go to. And we even talk about advanced care planning because as Leah mentioned, this is something that needs to be talked about, especially with this disease. And so there's information about the different advanced care plan documents, as well as tips and tricks for caregivers. If they're in a situation at a mealtime and they need, their participant or their loved one is, having a difficult time, they can refer to this binder with some tips and tricks on maybe how to address that situation. And so I just put up a few pages just to give you kind of an idea of the aesthetic. And so we use James L. West colors. It is, I believe, 64 pages. So it's a pretty comprehensive manual. We are in the process of assembling all of them right now. And so the needs assessment part of my capstone was a really big portion. As Cheryl mentioned, the day program is moving to a new facility that is larger, so they are expanding. And with this expansion, they're hoping to offer wraparound services. So this would be comprehensive services provided to people utilizing the day program, as well as people in the community who are dealing with dementia. And so services may include case management, social work, beauty salon services, counseling, on-site medical appointments. The point is really to wrap our arms around these families and give them all the things they need in one place. So the purpose of the needs assessment was to figure out if what we think people need is actually what they need, right? Because we want to make sure that those two things are aligned. So the needs assessment was completed in 3 parts. The first was a survey sent out to churches because we also wanted to make sure that the services we saw were what other organizations in the community saw as well. And we know that churches oftentimes, people go to those on a consistent basis. So churches may interact with older adults consistently and already be aware of some of the things they need or services that are lacking. So we kind of sent a survey to them saying, this is what we think. What do you guys think? And then we that informed our community survey that we sent out to ask people in the community, this is what we want to offer you. Do you even want this? Do you need it? And so we were assessing the likelihood of them utilizing the services we hope to offer. And the third was informal caregiver interviews. So I did interview a few of our caregivers who participate in the day program, just to get an idea of services in the community they see lacking, but also to give an idea of how the day program is working now. And as we move and expand, what are things we can improve as we begin to implement these new services, but keep what we've been doing for a while. So all 3 of these will be put into a summative report that I'm working on currently. So I am writing up a report to leave with James L. West that will have all the results of both surveys and all the interviews. So that is the needs assessment, just to make sure that when we're offering these services, we're making sure it's what people really need. And the last was educational training. So this was really for my personal growth. And like I said, to develop that specialized knowledge. So these are all the educational trainings I participated in, minus this bottom one that's coming up in April. But I really wanted to do this, like I said, because I knew I was going to be interacting with these participants, and I didn't have a really big knowledge of dementia and how to do that. And so I know I needed to equip myself with those skills. And it's been great because doing these simultaneously as I've been participating, it's allowed me to use the things I've learned in the trainings with my participants. So this has been really wonderful. And James L. West is a wonderful tool to find those education opportunities. So this was very easy for me to do. And then this is that area of focus clinical skills. So I just put up some photos just to show you what I've been doing when I'm not working on the other projects. My office is in the day program, so I have people coming in. I've gone on outings. We play Velcro ball. We've done some cooking and baking. So again, just working with these individuals and knowing how to communicate and how to interact has really helped my clinical skills, I think, because with occupational therapy, any setting you go into, if you're working with adults, there's a chance you're going to work with someone who has dementia. And so I'm able to use the skills I've learned just participating in the day program through the educational trainings to really help my interactions with those patients when I start a job, whether it be in a skilled nursing facility, inpatient rehab, hospital, anything like that. So just to give you kind of an idea, it's been really fun. I've had a great time. I love it here. So I really enjoyed my time. But yeah, just to give you a little short conclusion. So the assessments I talked about in the manual have really helped enhance the program that's already happening. And the needs assessment is to help in that program implementation when they start to work out the logistics of implementing these wraparound services. And then the trainings and my participation have really developed my clinical practice skills. So I will be disseminating this information here again with the leadership team. And I'm also hoping to record a video with the results to share with you all as well. Since this council only meets twice a year, it didn't really work out for me to present the final results, but I'm hoping to do that through a video for you guys, as well as with my university in a couple of weeks. So are there any questions?
Helen, I have a quick question for you.
Yes.
The educational trainings that you had on one of the slides there, were those done through James L. West or through other organizations, in person or virtual?
So they were all done through James L. West, and all of them were, well, one of them was in person, the rest were virtual.
Okay.
So I did the Dementia Live experience, which is kind of a simulation of what it is, and that's here on campus.
Thank you.
Yes.
Good job.
Pardon my tardiness, I'm Dr. Susan Priest with Cherry County College and I had to have some lab work done. Could you show us that slide again? I'd like to take a screenshot of
Yes.
you.
Yes, little plug. The education is wonderful. Always coming up after me, but they were wonderful. I learned so much. The dealing with dementia is a 4-hour where it's just like a big, what is dementia? What do you do? And Jamie led that one, and that one was fabulous. So they're all really wonderful.
So just so you all know, we have over 100 course offerings. These are some of my more popular ones. And since COVID, we have done more and more virtual. So they're more accessible to more people, which has been a great outcome of COVID, believe it or not. But we have so many courses, and we have support groups that are virtual and in person as well. So lots of resources on our website. And then I know Jamie or Emily is going to talk about our new Spanish courses, but we are adding more and more in Spanish speaking courses as well.
Cool. Thank you, guys.
Thank you, Kellen.
Now, what is amazing about that, there's an example of one of our students that comes through here. So we have got about 18 different schools that rotate through. And I just wanted to give you a little report on who we've had so far this year. In the spring, this year, we've had Fort Worth ISD, the CNA program that we're doing with them. We've had St. Kate's occupational therapy students. And we've had, of course, Kellen. We've also had some other Texas women OTA and OTD. In the summer, we're going to have Baylor Nursing. We're going to have a St. Augustine OTD capstone student that's going to come in and follow Kellen, which is going to be very hard to do. That's what I'm telling Jamie. Wow. Sure. Wow. I got to get a copy of this and tell them, following this here. Parker University OTA students are coming in this summer. Weatherford College OTAs coming in this summer. Chamberlain University, we've got a nursing student who is a doctoral student that's going to be coming in. And in the fall, we've got TCU RNs and LVNs. So we have lots of students who come through. We supervise our students. Our students go through an orientation, and we make sure that they understand that we are privileged to work in 100 residents' homes. We're working in their home. They don't live where we work. And we make a point that they know that. And we only allow a couple of students into each house at a time so that it's not just this invasion of students, but we want to make sure and get those students through here. Another thing I just want to mention to you, one of the great things that we get to do in education is we get to travel all over the United States. We actually get to go to a lot of places, but now on Zoom, we get to actually talk to people all over the world. And we have programs that we do with the Area Agency on Aging every month, and we will have 100, 200 people, sometimes 250 people. Singapore, the UK, Canada, Ireland, Australia. And I'll ask them, what time is it? And Singapore says, it's 11 o'clock at night.
Yeah.
And I try to put a lot of humor in things. And I said, and you're listening to this voice in Fort Worth, Texas at 11 at night? And they typed in, no one talks about this here.
Yeah.
And they're on every single month, listening to us talk about those very topics that you just saw up there. Some other speaking engagements that we have. I am still a teacher at HAR. I taught school for 20 years. I said this semester we've got in the spring. I went to Leading Age Oklahoma a few weeks ago and was in front of about 250 people while I was there. And my topics were sexuality and dementia and resilience in healthcare. That's a couple of the things, again, people don't talk about, but we need to know about. Hospice 101, those type things. We'll be going to Tala next week. Jamie and I will be speaking there, and I'm going to be talking about grief in healthcare. We're at I'm going to say the end of this 3 years. We're tired of hearing that word new normal. And I heard on a webinar the other day, why don't we call this reconstruction? This is reconstruction.
Yeah.
But in healthcare, we've got a lot of grief. Over 200,000 people left healthcare last year. In 2020, 31% of all suicides were healthcare workers. We've got a lot of grief in healthcare. Jamie, Kathy, Cheryl, and I will be speaking at Leading Age Texas next month, I think it is. And some of the things I'm going to be talking about: validation therapy and compassionate communication. And then next month also, Healthy Lives Matter and Dementia Friendly Fort Worth are teaming together, and they're doing a community conversation at the Potter's House here in Fort Worth. And I've been asked to be on that panel and listen to this topic. It's fantastic. Dementia, religion, and spirituality. Wow. 30 churches have been invited, 27 have already accepted.
What day is that?
I'll let you know. I've got it on my phone. Already this month, I've gone out and done some training at one of the largest churches. We got to get in front of these people. And the fact that we're able to get out there and teach about dementia, it's amazing. I think that's all I've got.
And we are privileged and honored to be able to be backed or advocated by the group here, the advisory council, to help us with the current workers and those future healthcare workers, but just the community at large with this dementia education. So we appreciate, just to piggyback all that, you're serving on this council, because we just heard the need, y'all know the need, and we still need to be out there. So I will give a quick update. So one of the students, I didn't mention, we will also have a UNT Health Science Center Masters in Public Health student doing her practice experience. This starting probably May, and she'll be with us for a year. She has to get in somewhat close to 900 hours, something along those lines. And we'll be doing some program evaluation with us. And so we're excited to have her again shoes to follow. But loving partnering with these organizations. Obviously, we have our students that come in that get to do their clinical experience with our residents, but just grabbing those other fields or disciplines and introducing them to aging services, but also dementia care. And you will meet her next when we meet again in September. Holly mentioned our Fort Worth ISD. We have talked about our partnership with Fort Worth ISD and their P-TECH program. We are currently, they're juniors, they're junior level students. This is their first year. Their junior level students are doing our certified nurse assistant school. So this whole year, we have been teaching those of 21 students, junior level students, to get their certified nurse assistant, go through the course and get their license. They're actually in the building right now doing some clinical hours with our residents. And they will be graduating in May. They'll be graduating our course in May. They'll be finishing up their junior year. But they will have the opportunity to test for their state license here at the West Center. So we have recently been or became a testing center through this Testing Center of Texas Prometrics. So our students, the Fort Worth ISD students, that any other CNA student that comes through our school will have the ability to do their state test here. So they'll kind of have that advantage of doing their test here, hopefully ease some testing anxiety, hopefully get some more success rate from that. But we're happy to be able to be a testing site and provide that for our students. We'll start the next juniors this next school year. So in fall. So we'll be at Fort Worth ISD for the fall semester doing those lecture hours, part of that state curriculum, and the students will be back here next spring to do their clinical hours.
How much did you say that pool was, please?
The one currently is 20. Our max is around that,
Around
20. Our max that we could be able to take as students is about 20.
Thank
Just for them to be with our residents. We don't want to overwhelm the residents. But. And you see there are some brochures there as well. We are a certified nurse assistant school approved by the Texas Workforce Commission. And we are recruiting to help with the workforce development. Of course, all industries have been hit with staffing shortages, but we are offering the CNA course to anybody. It is a free course, so free tuition, free books. It's part-time. We'll have some day hours, but we're also going to be offering evening and weekend classes as well. So help us spread the word on that. And again, they'll be able to test here, those students as well.
And it starts in September, you said?
We have one starting in late April and May. Yeah, a couple of classes coming up, whether they meet in the day or the evening. And we have great instructors for that. And the last thing I want to talk about and we go with is our bilingual education. So Emily, this can come up here, but I'll share a screen really quick. We are thrilled to be able to offer a bilingual education. So expanding the education services we've already been offering to the Spanish speaking population that's under-resourced and really becoming a trusted name in that community, because we know that they need help. We know the incidents. I'm going to pull up some slides here. This kind of group over here, this developed or created an advisory council for the bilingual education calendar as well. So they're actually going to stay a little bit longer, and we're going to do some work after this, but they'll join here too. But I'm going to pull up the slide. Emily, if you want to introduce yourself.
So my name is Emily Rodriguez, and I am the bilingual education coordinator here at James L. West. And we started this bilingual education program last June, and we have been in the community ever since. So we have been in different places around the community, like different community centers, churches, as well as other organizations like Cornerstone Medical Assistance Network. So we currently offer a few different programs of our English programs, and we're working on trying to get the rest of them translated just as we see like the need arise. We currently offer Dealing with Dementia, a Dementia Live, a Healthy Brain Aging series, and then we just recently introduced Stress Less with James L. West, which we are also working on getting translated.
And I failed to mention, because I need my notes, but this program, the bilingual education program, it was initially, the James L. West Board gave initial funding for this. And so we had Emily part-time. She started in June. And then we were awarded funding through the ARPA grant through Tarrant County to bring her full-time for 2 years. So this program is funded through that for the next 2 years. But we can see the need there. Latinos are 1.5 times more likely to develop dementia. And there makes up 29% of the population right here just in Tarrant County. So we're hoping to meet to really infiltrate, if you will, that population and be that source. And there are 3 kind of goals that we are dedicated to as we are working through the next 2 years. And it is to be the trusted name in brain health, but dementia and caregiving within the Hispanic community. We really want to be accessible throughout Tarrant County to this population. So we are going to where they are at. Emily just named off the partners we're already do programming with. That's where this population is already going. So we want to go to them. And then create this referral and support network. Really become with like missioned partners. You know, we have Dementia Friendly Fort Worth. We've got the group over here and many others that we just want to be able to be referral sources for this community. Obviously, we want to be the experts in our brain health and dementia and caregiving, but also know that there are a lot of other resources out here and make sure that they get in front of those. And we appreciate you spreading the word. You do have a list of those programs that Emily listed or named off here as well. And then we have several other materials in English and Spanish as we go forward. Any questions? Partnership posters. Thank you. We have our community partnership poster up here. So just listed some of our current partners or community champions that we're working with are up there. And we created that Cerebro Sano logo, or Emily did, just creating this program, you know, around brain health and dementia and caregiving that is unique to our bilingual education programs.
We had a fabulous launch.
We
of this
did.
Program. We had media. I just saw the Fort Worth report. There was a great article in there too.
And we appreciate, so Eva is on our board, but she's also really a spearhead of, you know, spearheading this initiative and this launch for our bilingual. So we appreciate
Oh, and you're told too.
I just think this is excellent because you can't be an expert if people can't access your services.
Right.
Right. And so I think this is so wonderful. This is so needed.
Well, thank you. So any,
You have a great board.
Yeah.
Coming up.
yeah. So any, do you have any ideas or say, hey, did y'all know, I've got this contact we want to get you in front of, or do you know of any other organizations that you think we would like to partner with? Please let us know. Any other questions? It was a packed agenda. I'm gonna quiz you now. We got a few minutes left. But we wanted to make sure you all had the updates. Hear from other partners. We hope this council is also a networking referral source for you all as well. And please know that we are here to collaborate, partner. We love doing that, so don't ever hesitate to reach out.
I've got that date, Jamie.
Yes.
You'd asked about the date.
Yes.
It's at the Potter's House, Fort Worth. It's on Saturday, April 15th. And it starts at 9 and goes till 12:30. So there's going to be a panel discussion, and then Dr. Sid O'Brien is going to be the speaker during the luncheon later in the morning. So it's Healthy Lives Matter, Dementia Friendly Fort Worth hosting this. April 15th at 9 o'clock at Potter's House, Fort Worth.
You say 9 a.m. to noon?
12:30, I think. Yeah.
I think that's not the only thing. Yeah.
Well, we appreciate you all. Thank you all for joining, for those of us that joined us online. We will send out the recording to anybody that didn't make it, and then the PowerPoints as well this afternoon. So you'll have access to those.
Yes. Age friendly Fort Worth.
Well, thank y'all so much. Have a great rest of your day.
Well done.
Thank you guys, and thanks for partnering in it.
It's the-
That's-